Hi everybody, I'm Dr. Mark Stengler, and recently on our radio show Forever Young, which you can listen to on SiriusXM radio station, as well as many other stations throughout the country. You can get those listings at americasnaturaldoctor.com. We had a very interesting conversation with Jim Lavalle. He's a pharmacist and certified clinical nutritionist, and we discussed 3 new studies on aged garlic extract. Now, a lot of people have heard about the health benefits of garlic and garlic extracts for cardiovascular disease, but this really took it to a whole other level. And again, these studies were done with aged garlic extract by Kyolic, and they've actually had over 870 peer-reviewed articles from leading universities, research institutions on their product. So very, very interesting, a very, very credible product, one that I've used with patients for years. But in the first study, we talked about how aged garlic extract reduces multiple risk factors for cardiovascular disease in people that have diabetes. And as you may know, people who have diabetes are at much higher risk, and they have greatly accelerated progression of things like inflammation in arteries, plaque formation, all sorts of cardiovascular diseases. And so anything that can help guard against that obviously is very important, beyond just things like diet and exercise, which are foundational. In this study, they're actually able to show that aged garlic extract was good in terms of retarding atherosclerosis, plaque buildup in the arteries. And as well, the people compared to placebo who were taking aged garlic extract had better endothelial function. So that's inside the blood vessels, where we normally have a certain amount of flexibility to our blood vessels. Those are signs of healthy blood vessel walls. And so aged garlic extract can be beneficial for that. The second study was on people who had high blood pressure. And in this study, on average, people's blood pressure was reduced. Systolic, the first number, was reduced on average by 8.3 points, and the diastolic reduced by 5.5. Now, you may think that's not, dramatic changes in numbers, but actually it is. Numbers like that, you can often keep people off of blood pressure medications who are kind of that mild hypertension. Or maybe people have moderate high blood pressure. It allows them to not have to use more medications for their treatment. And also in this study, they found that people who took the aged garlic extract compared to placebo had significantly decreased risk of heart attacks. Of course, obviously that's very important. And then the third study was done on people with their coronary calcium scores. So when people have inflammation in their blood vessels and their body's forming plaque, you can identify that for the most part with what's called a coronary calcium score, which is basically CT scan of your coronary arteries and getting a 3D image. And you can see how much calcification the rating is in terms of the calcification of the arteries. In this study, the people who took aged garlic extract were shown to have an 8% decreased progression rate of coronary calcium accumulation compared to people taking placebo. Also very important, people taking the aged garlic extract had a decrease in the vulnerable plaques that they were forming compared to people taking placebo. These are the types of plaques that can break off and then cause a heart attack or stroke. So that protective effect is very important. So if you'd like to listen to this interview, and I'd really recommend you do if you're interested in preventing heart disease, if you have high blood pressure, if you have diabetes, very important brand new information, go to americasnaturaldoctor.com, and there it's episode 151. Again, that's the interview with Jim Lavalle.